Welcome, everyone, and a very special welcome to those of you who are joining us live via webcast in Ottawa and in Thunder Bay, and throughout the province. This is a very exciting day for us, and we're glad to have you all live and virtually here with us today. Before we begin, two things. First of all, I'm going to ask if you have your phones on a setting that will make a noise. Could you put them on silent, please? Vibrate, mute, whatever works for your phone. Because we are webcast and we don't want that to be disturbing. And then before we actually begin, we're going to ask you all to stand and have a moment of silence in recognition of the victims of yesterday's incident here in Toronto. Thank you. As we begin this event, I'm going to take a moment to acknowledge that we are meeting on Aboriginal land that has been inhabited by Indigenous peoples from the beginning. As settlers, we were grateful for the opportunity to meet here, and we thank all the generations of people who have taken care of this land for thousands of years. Long before today we gather here, there have been Aboriginal people who have been the stewards of this place. In particular, we wish to acknowledge the ancestral traditional territories of the Ojibwe, the Anishinaabe, and in particular, the Mississaugas of the New Credit, on whose territory we are gathering today. We recognize that this territory is covered by the Upper Canada Treaties, and we appreciate the historic connection Indigenous people have to this place. We also recognize the contributions of the Métis, Inuit, and other Indigenous peoples that they have made in shaping, strengthening this community in particular, and our province and our country as a whole. My name is Martha Foster, and I'm the chair of the Board of Directors of the Retired Teachers of Ontario, or RTO-ARO, as most of you know us. With me today is Ted Young, and I will call him up here in a minute, a director with the National Association of Federal Retirees. He's here on behalf of the association president, Jean-Guy Soulière. Together, we are partnering as Vibrant Voices, Voix Vibrant. Vibrant Voices is a collaboration of non-partisan, not-for-profit membership-based organizations representing Canadian seniors and retirees from coast to coast to coast. Together, our organizations represent 150,000 members in Ontario, in 46 RTO-ARO districts and 22 federal retiree branches. Today's town hall is an important one. It is the Vibrant Voices kickoff. It's the event starting us into the Ontario election. Over the coming weeks, we will engage and inform our members on party positions and policy issues that are most relevant to them and to all seniors here in Ontario. There are many issues we care about as seniors. We believe that engagement, care, and the quality of life should not have an age limit. With the help of our politically active members, we are focusing on some key topics for this election season. We are speaking out about health care, specifically the need for more geriatric training, for home care and long-term care. We're also focused on ways to take action against elder abuse. And we advocate for the development of age-friendly communities that support citizens of any age. Retirement income security is also an important issue that we're highlighting. We encourage you to tweet or to share on social media throughout this event using the hashtag Vibrant Voices or hashtag Voix Vibrant. If you're tweeting in French, that's the code to use, the second one. The Wi-Fi code is, for this room, capital R, capital T, capital O, 2018. It's listed at the top of your agenda for easy reference. And now I'm going to call up Ted.
Well, thank you. Thank you very much, Martha, and good afternoon, ladies and gentlemen, and welcome. As Martha said, I'm here representing the president of the National Association for Federal Retirees, Mr. Jean-Guy Soulière, who is unable to be with us today. We especially today want to welcome all of those of you who are joining us today via the webcast. Particularly, I want to give a big shout out to our federal retiree and RTO, ERO members who have come together in Thunder Bay, Ottawa, and other areas for local viewing parties. We're keeping our members engaged and informed during this election because Ontario's next government has an important role to play in adapting public policies and systems to the needs of today's growing seniors demographic and in future-proofing our policies and systems for tomorrow's seniors. As we will hear today and over the coming weeks, addressing these issues is of critical importance to the well-being and success of generations of Ontarians. We are most pleased to welcome the Honourable Minister Deepika Demerla, Liberal MPP and Minister for Mississauga East, Cooksville, and is Minister of Seniors Affairs. And Todd Smith, Progressive Conservative MP for Prince Edward Hastings. And last but not least, Teresa Armstrong, NDP MPP for London Fanshawe. Welcome. We're looking forward to learning more about your party's take on senior-focused issues. I am sure this will be a lively discussion on how to make Ontario better, not just for retirees and seniors, but for all its residents. After all, we all hope to become seniors. Without further ado, I'll introduce our moderator, Mariaki Walsh. Mariaki is an author with iPolitics, a leading in-the-know political news source that provides current and influential information and analysis for a savvy readership. iPolitics is also a proud partner of federal retirees. Mariaki is the Queen's Park correspondent for iPolitics. She is a long-time political journalist, first starting her career on Parliament Hill, working for CBC and Global News. After reporting on the political scene in the East Coast, she's thrilled to be back home in Toronto to cover an election that will turn our heads across this country. Mariaki, welcome. And Martha, back to you.
Thank you, Ted. A couple of final notes before we hand this over to Marika. We invite our audience to participate in either official language today, whether you're with us here in Toronto or joining us virtually. For those of you on the webcast, you can submit your questions at any time through the chat function on the right-hand side of the video player. For technical support, use the box directly below the video player. RTO ERO, federal retirees, and Marika will facilitate communications between our audience and candidates. And at this point in time, I'm going to invite Simon Coakley, who is the Chief Executive Officer for the National Association of Federal Retirees, to explain and to talk about the active French offer. Simon, you're going to speak from there.
Arthur. Donc, la discussion ici à Toronto va se dérouler presque uniquement en anglais. Mais si vous avez une question que vous voulez poser en français, s'il vous plaît, le faire. Et je me chargerai de faire un bref résumé pour que nos participants puissent comprendre en anglais qu'est-ce que vous venez de dire. Merci.
Merci. And Marika, stage is yours.
Thank you. Hi, everyone. I'm Marika Walsh, and I'd like to welcome our politicians as well to the stage. Thanks for taking the time today. I know it's a very busy time, the pre-election cycle. Feels like we're already in the election cycle some days at Queen's Park, but I appreciate your time here. So just to explain for our audience here and also elsewhere in Ontario, we're going to have opening remarks from each politician to start off this conversation, and then we will have a bit of an exchange moderated by me with questions suggested by me and also by the organizations that are hosting this event. And then it's your turn to ask the questions. That will happen around 2 o'clock. So if you want to start thinking about what you want to ask ask the politicians that you have on stage here for the next 2 hours, please start to think about that, and please make sure that when you're thinking about it, the shorter the question, the more questions we can get in. So brevity sometimes is the best policy. So I'll just let you keep that in mind. And I will also say that, as Martha mentioned, Jim and Simon will be the ones choosing the questions from the webcast. So we'll alternate between this room and also the webcast. So also a reminder about tweeting. Even if you are tweeting, please have your phone on silent, but please do tweet and get the word out about what you're hearing here today. And just so everybody knows how the timing is going to work, each MPP and the minister will have about 5 minutes, maybe 10 minutes, to give their opening statements. Candace is the one sitting here. She will be responsible for timing us and keeping us on the clock. So she will flash a time for each person as they're speaking for 5 minutes. So if you want to keep it to around 5 minutes, then you know when to wrap it up. In terms of the Q&A part, we're going to hope to keep the answers to about 30 seconds so that each person can weigh in on the issues that we're asking about. And we'll sort of go from there, and then we'll wrap up around 2:45. So with all of that housekeeping aside, let's start with the opening statements. And Minister Demirla, we'll start with you.
Thank you so much. And I just want to say, my notes say good morning, but I think good afternoon might be more appropriate. So good afternoon, everyone, and it's an honor to be here today. And before we begin, I also want to express my sympathies for the victims of last night's tragedy, and our thoughts are with them. And I want to thank each and every one of you for taking an interest in the well-being of seniors. You know full well that ensuring our seniors are well cared for requires a true understanding of their evolving needs and a deep appreciation for the challenges that come with aging. As Ontario's First Minister of Seniors Affairs, it's been a real privilege. And I've traveled across this province and spoken to seniors, their families, and organizations dedicated to their care. And this ongoing consultation continues to inform our government's approach to caring for seniors. As I traveled the breadth of this province, there are 3 things that seniors told me. It didn't matter whether they were in downtown Toronto or whether they were in Sudbury. Didn't matter whether it was rural Ontario, urban Ontario, northern Ontario. These 3 things I heard over and over again from you. The first, we are living longer than ever before, and it's a good thing. It's the gift of life. And I personally take objection to any characterization, particularly in the media, you know, those sensational headlines, gray tsunami, silver tsunami, because living longer is what we've always wanted. To me, it's the miracle of modern healthcare. It's something we've always wanted, to live longer and healthier, and we're doing it now. And what I've heard from you is we have the gift of time, and now we want to make the best use of it. Just because I'm 70 or 75 doesn't mean I don't have new goals, new dreams, new aspirations. Please, government, don't look at us only through the lens of healthcare. Look at us as the full spectrum of needs. Look at us as somebody who wants to live a full life. The second thing I heard was we want to live in our own homes for as long as possible. That's not negotiable. Across Ontario, I heard that. And then I heard the companion piece, which is we want our independence, but it can't be at the cost of becoming lonely. It can't be at the cost of getting socially isolated. So we took these 3 threads. Living longer, we want to lead full lives. We want to live in our own homes, but that doesn't mean we want to get socially isolated. And we crafted a really robust senior strategy called Aging with Confidence. And the whole point of Aging with Confidence was to help seniors with these 3 aspirations. I'm not going to go through the entire strategy, but I will highlight a few important threads that speak to how we tried to marry these three desires of Ontario seniors. One of the things that we have done is expand our seniors' active living centers. As of a week ago, we had 263 seniors' active living centers. Last Thursday in Brampton, I announced that we are expanding 40 more seniors' active living centers, making for 303 centers. And why is this important? It's important because it gives people, seniors, a dedicated place to come to learn new skills, to meet their peers, to create those relationships that are so important to our mental health, to our social well-being. Another example of what the strategy does, and I know it's a priority for many of you here, is age-friendly communities. We instituted last year what I believe is the first time Ontario's own awards for age-friendly communities. And we had about 36 municipalities recognized this year as meeting that standard for Ontario's age-friendly communities. But we are going further. In the last mandate, early in the mandate, we funded a lot of municipalities across Ontario. If memory serves me correctly, I think it was 47 municipalities or 56, one of the two. And what we did was we gave them money to say, do your due diligence and find out what are the gaps in your communities that you need to fill to make your communities age-friendly. How many minutes do I have left? 5? Okay. And now, through the strategy, we've come back and we are funding these very municipalities. They identified the gaps in the first go-round, and in the second go-round, the province of Ontario is funding $7 million to municipalities across Ontario to fix those gaps. Another example that I'm really excited about is called NORCS. It's a really innovative strategy. It stands for Naturally Occurring Retirement Communities. We're investing $15 million in this. And what does NORCS do? It takes a high-rise that doesn't have to be a seniors building. It's any high-rise. If it has a critical mass of seniors in it, say 30, 40 seniors families, then what about if we layered that? What if we put in a full-time coordinator from the LIN to coordinate the personal support workers and the home care? And what if we layered that and put in once a week congregational dining? And then what if we layered that and put in, say, once a week recreation? You have a de facto retirement community without you having to move out of that building. These are just little highlights. I don't have enough time to go through the entire strategy. It is available on my ministry's website. We have about 20 different initiatives, all going back to that idea of we want to live long, we're living longer, we want to live on our own, and we want to stay socially connected. But there was a fourth piece that came out of those consultations, and that was this nagging worry about living on fixed incomes. Now, many of you in this room know what that's like, what that's about. And so in this budget, we've brought forward some more initiatives that do two things together. They sort of address that insecurity around, we're living longer and our savings have to last a long time and we are on fixed incomes, as well as, once again, reinforcing that desire to live independently. One of the things that we have brought forward in this budget is a benefit for seniors over the age of 75 will get up to $750 a year for things like snow removal, light housekeeping, any of the things that would make it easier for a senior to continue to live on their own. Because sometimes it's that inability to remove snow that can tip somebody into having to go into a retirement home, for example. Another thing, I suspect many of you have dental and drug coverage. Anyway, not drug coverage, all seniors have, but many of you may have dental coverage. But there are many Ontarians who do not have dental and drug coverage, so we are bringing forward a form of extending OHIP Plus so that more Ontarians have dental and drug coverage. These are just examples of some of the initiatives that we are bringing forward through this budget. We're investing in healthcare because that is something, you've told us don't look at us only through the lens of healthcare, but healthcare continues to be important. You want the healthcare to be there. when you need it, and that is why, since 2003, since our election, you will be surprised to learn we have built 21 new hospitals in Ontario since 2003, and 40 are under construction. This budget, we said $822 million more for hospitals. And of course, we announced in the Aging with Confidence, I forgot to mention, that we will be building 5,000 new long-term care beds over the next 5 years and 30,000 long-term care beds over the next 10 years. And last week, we made good on the promise of the 5,000 beds when we gave out the first 5,000 licenses. What makes it really special is this time, those beds are also culturally diverse, recognizing Ontario's diversity. And finally, I'd like to say in conclusion that it's the job of the Minister of Health to add years to our life, and it's my job as your Minister of Seniors to add life to those years. Thank you.
Thank you, right on time. So I can tell the other MPPs are itching to weigh in. So MPP Smith, I'll leave it to you for opening.
Thanks, Marika. I don't plan on taking the full 10 minutes. I just wanted to introduce myself and explain to you why the energy critic from the PC party is appearing here today.
I wondered about that too.
I am the member for Prince Edward Hastings, and I'll be running in the next election in Bay of Quinte riding, which happens to be one of the oldest, as far as the demographic goes, in Ontario. So I do have a lot of seniors in my riding. I guess that's the connection, but there's a lot of people very busy. I had a lady when I was going door to door on the weekend who said to me, she said, "Todd, what am I going to do on the morning news now, because you guys have settled everything in the PC party? The last 3 months, we've been very, very newsworthy, to say the least. We do have a new leader in place. Our policy is being formed, and we will be rolling that out as we have been over the last couple of weeks leading into the election." So, while a lot of you are here today looking for specific answers, I will have some general comments, and I will be able to address some of the things that I have been hearing while going door to door and as the MPP for Prince Edward Hastings for the last 7 years in talking to the residents in my community. My wife is a high school teacher, for those of you who are here with the retired teachers. She's the head of the co-op program at a school in Belleville, Moira Secondary School. Very, very aware of not what retired teachers are doing, but what current teachers are facing. But I am very aware of what's happening in our healthcare sector. I would just say that the three things that I've heard while going door to door and in my riding over the last 7 years, affordability for seniors is number one, or the unaffordability. As the energy critic, one of the biggest reasons for that unaffordability is the rising cost of electricity, which has exploded by 300% under this Liberal government. There are all kinds of different reasons as to why that has happened, but that has played a big role in the unaffordability for seniors trying to stay in their own homes. I recall in the last election going door to door and talking to many seniors who were in fact losing their homes and others who were living in their car because they couldn't afford their home any longer. In rural Ontario, where I'm from, electricity bills at that time were soaring in the neighborhood of $800 a month for some people. You can imagine on a fixed income, it's impossible to live that way. So that's a big reason why we have this unaffordability crisis in Ontario for our seniors. We have to make sure that we start putting money back in seniors' pockets and not in government pockets, and not paying exorbitant salaries at Hydro One. Okay, I'm going to give it up for the energy stuff for now. But it is a big reason why. Access to healthcare is another one, and I really hear this a lot in my riding. Down in Prince Edward County, there's a beautiful seniors community down there. It's called Wellington on the Lake. I don't know if you have any friends or relatives that live down there. It's a great place, a very, very active community, but I went door to door there. They affectionately call it Wrinkle City. It's a great place to live. They love it there. There's a lot of great things going on in that community, but what I did hear from people is access to a family physician is scary right now. A lot of our family physicians are retiring. Those family physicians were taking rosters of 8,000 patients. And now there are 8,000 orphan patients out there every time one of them retires. So we really need to address that crisis, because it's not just seniors that are losing their family doctor, that in many cases they've had their entire life, but it's young families as well that are experiencing the same thing. The access to home care is a big concern as well. The government has made a decision, and the minister just alluded to the fact that more people do want to stay in their home longer, but they want to make sure that they're getting the home care that they require in their homes. And they're not getting it. I'm hearing it loud and clear from people that they may need more than 8 hours a week in care, and they're even struggling to get that 8 hours a week. PSWs aren't showing up for their shifts. This is a real concern for people who do want to stay at home. The situations in our hospitals is a crisis right now. There's hallway health care in our hospitals. It's been well documented that, of course, seniors are spending a lot of time in the emergency rooms at our hospitals, waiting to see a doctor in emergency. The waits in my region, it's not unheard of to be in there for 10 to 12 hours, waiting to see a doctor. And of course, the access to long-term care is a big concern as well. You know, one of the policies that we did roll out a couple of months ago was that we were going to build new long-term care beds, 15,000 in the next 5 years, 30,000 over the next 10 years. And we will do that. We'll build those homes. We've made that commitment. It wasn't until just recently that this government actually started to realize that we had a major shortcoming when it came to long-term care beds. The waiting list in my riding can be up to 1,000 days for some long-term care facilities. It's just unacceptable, and that's putting a strain on our hospitals as well. So there's a lot of problems out there that need to be addressed. We'll talk about them over the next hour and a half or so, and I'll cede what time I have left to my good friend, who's also a Loyalist College graduate from Belleville, just like me, Therese Armstrong.
Go for it.
So good afternoon, everyone. I'm, of course, Teresa Armstrong, MPP for London Fanshawe, and I'm very happy to be here today, and I want to thank the RTO for having the vision to start these conversations early, because when we're in the thrust of an election, there's so many debates going on, we can't make it to other places and all the debates available. You've captured us. We're at Queen's Park. And so this is so wonderful that I'm able to talk about our platform today and some of the issues around seniors to an audience other than my local London Fanshawe people. So that's a really inspiring and privilege that I feel that I have. I'm able to talk to seniors outside of London Fanshawe that I represent. And when I think about this name of the forum that we have today, which is called Vibrant Voices, it says that the population that we have in Ontario, seniors, and I don't really like that word because now we're getting, the age of seniors is being pushed ahead so far. 55 is now a senior, what I've heard. So that means in 2 years I'm going to be a senior. Like, how is that possible? And so how is that possible? Exactly. So I relate to that and think to myself, if I feel, young at 55 and they're calling me a senior, I know that the seniors I've talked to, that they feel just as young at heart as the name of seniors. So seniors are not the same faces that we have learned to have an image of in the past. The new 65 is the new 45, the new 85 is the new 65, and it is actually true. We have most of us, and we're fortunate, we have access to a good quality of life to help us maintain our health. And our health speaks to whether or not we can be vibrant and active in our communities. So I know seniors are not just about healthcare, absolutely not. No one is one-dimensional when it comes to demographics. But we need to understand that healthcare, for us to continue to be vibrant voices and active in our communities, we need to make sure that we look after our health so that we can enjoy the hard labor, the work that we've done as seniors and built up this community and built up our Ontario, and enjoy our years of our next phase of life. Because I think throughout the journeys we have, we can contribute every step of the way in a different way towards our local communities, our broader communities, the province, and Canada at large. So that's something I think I have a vision for seniors. Age is not a factor when you can say, there's something I want to do with my life, whatever that may be. It's not a factor. So I always look to that as an inspiration. And I do want to put a shout out to teachers. I had met a couple of teachers at the table, and I've said this before. You know, we think of teachers when we were kids, and even now, I have such good memories of going through the education system and meeting teachers, and I put them on a pedestal. Right from the moment I was in kindergarten, I had a wonderful teacher that I still remember her name today. Now, I can meet somebody a couple of weeks ago and, shake your hand, and then I meet you, a month later, and the name, I know your face, but I can't remember your name. But I'll never forget my kindergarten teacher, Mrs. Bladdock. And from there forward, I had the best experience in the education system with the teachers that I had contact with. So you really do build our future generations. And so when you retire, when you're ready to take a step back and have some leisure, that's up to us to make sure you have a good quality of life. And that does begin in age-friendly cities. That does also begin in preventative medicine, making sure that you have an active life. And then when it comes to that, if it comes to that in some point in time, when you have to access health care, it's there for when you need it. And the quality of care and the level of care that you require is there without any hardship. And not only do I hear that from seniors, but I also hear it from family members. Because seniors, generally you have perhaps daughters and sons, you may have partners, you may have friends that are part of your community. And they take on some of those health care issues when someone is in need at that time in your life, when there is a full circle. And so we have to have also supports for those families and friends that are there to surround you, and make sure that it's going to be a transition into the next phase of your life as quality and as dignified and as respectful as it needs to be. I'll also talk about affordability as well. We all need to make sure when we retire we have an income that we can sustain our lifestyle, our home. And it's important when we talk about affordability, how do you absorb all the expenses that you had when you worked and now you have that limitation. We talk about that in our platform. We have it online, and you can find it at www.ontarionDP 2018 platform. And it's no secret that 80% of Ontarians did not want to sell off Hydro One into private hands. They wanted to keep it public. So one of our main platform pieces is that we're going to buy back Hydro into public hands, and we're going to do that through the dividends that we currently have shares in and buy it back slowly. We also don't think that seniors should be penalized being home, and you have that time of use. That's when when you use the hydro, it's a prime time. I think we need to make sure that we're not working for hydro, but the hydro is working for our lifestyles. You do have seniors at home, single parents, all kinds of demographics that can't control when they're going to do their laundry and cook their meals. We also have some other pieces in here of affordability. One of the things that we've come out very early on was about pharmacare, universal pharmacare for everyone. No one should have to worry about how they're going to pay for their meds, or ration their meds, or skip a medication to make that last longer. When we have those circumstances, it costs us more, and it also means that we're going to have other medical side effects in our health, which again costs more. So if you're not taking your meds, I mean, here, yes, many of you have been so fortunate to carry on benefits into your retirement, and that's because you had a good union and you bargained well. And that's important too, but not everybody does. So when we're talking about people who need medication and they're not taking their pills, it does cost our society. Economically, people don't go to work, right? They're not feeling well. They go to emergency rooms where they really shouldn't be because they're not taking their meds. So there's exacerbated health complications. They see their doctor more often. So there's a wide variety of complexities as if we don't have access to medication. And then we talk about or speak to the people who are working part-time, contract, through temp agencies. The other thing that we have talked about for affordability is about dental care. We believe everyone should have access to dental care. There is, I think it's 2 out of 3 people go to the emergency room every 23 minutes. There's someone accessing emergency room or a doctor for dental care emergencies. So that is really important, and we think it should be for everyone again. It's time that we look at oral health as part of our overall health. It's a preventative medicine as well for seniors, so that you can have that vibrant life, you can have that active life, you have that quality of life. And for me, even at the age I'm at, health is a primary piece of my overall well-being before I can access any of those things. And if we don't feel good and we don't have those things happening, it's hard to get out to the gym, it's hard to participate in our community and volunteer, you know, all those things that we want to do and that we're vibrant seniors. So I want to say thank you very much again for having me here, and I look forward to the opportunity to answering some of the questions and the focus that we do have on seniors in our platform, because we've been listening not just for the last little while, but for a very long time to seniors, and I hope that some of these things will be crafted to your expectations. Thank you very much.
Okay, thank you all. So now we're going to move into the more formal questions. We're going to start on long-term care, not because I think that's where everybody wants to head, but because that's actually where all 3 parties have actually put forward their plans for long-term care. So that's where we'll start, and then we'll move over to aging in community, to home care, and to senior security, both mentally, emotionally, and physically. So I have questions for each of you, and you'll have about 30 seconds to respond. Minister Demerla, I'll start with you. The Ontario Progressive Conservatives and the NDP are both promising to build 15,000 long-term care beds in the next 5 years. Your party is promising 5,000. Is that enough?
Well, we've actually promised 30,000 over 10 years.
But for the next 5 years.
5,000 over the next 4 years. I think, you know, when I was the Associate Minister of Health, I can tell you that as a government, we put in place a capacity planning division. So we actually created one at the Ministry of Health. So we were the first to come out with that 30,000 number, and I see that the other parties are in that same range, which is great. We do need to build them. But I just wanted to assure everybody that the key thing here is that this number of 30,000 is evidence-based. The timing, you know, every party has come out with a slightly different timing, but I think we're all in a good place in the sense.
Okay, and I'll ask you, Mr. Smith, to weigh into what the minister said, but also for your own party, you put forward your idea, I believe, this past week with no price tag. And other parties estimate that the price tag is $2 billion. So while you're also promising this and also promising tax cuts, how do we square that? How do we pay for it?
So the government's been asleep at the switch for the last 15 years when it comes to long-term care beds. That's why we have to get these built. I think that's the most important thing. We have to get the bricks and mortar built. The other part of that is, though, that we have to make sure that we have the staff that are able to fill these spaces in these long-term care facilities. Prior to getting into politics and broadcasting, I worked in a long-term care facility. I know the strain that's on the workers there right now because the acuity or the issues facing the seniors in those homes now is much more significant than it was 30 years ago when I was in that business.
But if it's not costed right now, how do people who are voting choose? You know, are you going to end up, when push comes to shove, and if you form government, you're going to be deciding between a lot of promises that have been made. how do you choose between a tax cut or funding a long-term care or going into deficit? How will people see that vision roll out?
We're committed to building these beds. We have a government right now that said they were going to balance the budget this coming year, and they're running a $6.7 billion deficit this year because it's an election year. They're promising all kinds of goodies. We know that we have to pay for those beds. We have to build those beds now. Our seniors need them, and we need to take the pressure off our ALC beds in our hospitals, and by building those beds, we can do that.
Okay, thank you. Ms. Armstrong, the long-term care plan that you've put forward is, again, for 15,000 beds in the next 5 years. How do you differentiate yourself from the Progressive Conservative Party? We've seen that you plan to raise taxes and also go into deficit. So we know how you're thinking about funding it, but how do you then differentiate the policies?
30 seconds is not enough time, I have to say, to answer the questions, just to put it out there, okay? So yes, our commitment is to 15,000 beds in 5 years, but overall we need to build 40,000 beds within 10 years. One of the things that we have asked for is for this government to take the public inquiry that's happening now into long-term care and have terms of reference that we need to look at for systemic issues. We need to understand what the good, the bad, and the ugly is in order to actually come up with solutions. One of the terms of reference that we talk about is capacity, availability, and accessibility in all regions. So if we look at those things, then we can talk to the people that need them in rural and northern Ontario and understand the needs for capacity, accessibility, and availability. So that is how we're going to make sure we get them in the right places. The other piece of that, you're absolutely right. We have costed our platform, and in order to pay for some of the things that we need, because as a government, our role, we need to understand how important public services are to Ontarians. And therefore, we need to pay for those things. And what we're saying is the people who are making the wealthiest need to contribute as well, and as the most profitable corporations need to pay their fair share so we can get our public services like that.
Okay, Minister Marilla, I just want to go back to you on your answer. Mm-hmm. So for people watching here, how are they supposed to know what is the right number? If you're saying 5,000 in 4 years, and the other parties say much more is needed much more quickly, how can you explain that?
So I think what's really important is to keep in mind two things. One is that our numbers are evidence-based. The Ministry of Health came out with these numbers. We did this as a government. This wasn't part of a platform, but this was we announced this as a government based on evidence. The second piece, and I think you hinted at that, is we've already given the 5,000 licenses out. You can say anything, but what's the track record? That's what I think I would ask people to look at. Our platform is costed. We know how much it's going to cost. We have already given the first 5,000 licenses out. Work is already starting on the next set of licenses that need to be given out. This is our commitment, is at least 5,000 over 4 years. That doesn't mean we can't build more than that. The other piece is, how do you pay for it? So ours is fully costed. And I do have a question for the Conservatives, which is, I know that they talked about Hydro One, CEO compensation, but this is the same party. The first thing that they announced, the first big piece that they announced was a tax cut to corporations, to the Royal Banks of the world, to the CIBCs of the world. That's going to cost the Ontario Treasury $1.3 billion a year. How are you going to make that up? Because I could have used that $1.3 billion to roll out the first 5,000 long-term care beds.
I'll get you to weigh in on that.
Well, it's the same government that spent $1.1 billion to cancel a gas plant. So, I mean, if they want to talk about
yours
billions wasted,
yours is a year, annually.
If they want to talk about billions based, I mean, seriously though, we have to get the economy moving again. We have to get household income.
But the economy is the strongest in the G7.
I can tell you that the average household income from 2005 to 2015 has increased 3.7%. Compared to Saskatchewan, it's 37%. So while there may be, the economy may be rolling, people are not benefiting from that. We need to create good paying jobs in Ontario again, and we need to get, we've lost 350,000 manufacturing jobs in Ontario. We have to get the economy rolling again and stop wasting money. We've got a lot of people here that understand healthcare and know how much we've wasted in healthcare over the last number of years. I'm sure we'll get into the bureaucracy that now exists in healthcare that didn't used to exist, but there used to be 7 deputy ministers in the Minister of Health. Now there's 27 deputy ministers. There's local health integration networks and sub-LHINs. It just goes on, and we need to get back to running our healthcare efficiently.
Okay. MPP Armstrong, do you want to weigh in, or are you good?
Well, I'm going to let those two duke it out. But what I want to talk about is ways we can improve seniors' health, right? The cost of profit homes and profit healthcare, that adds to the cost of healthcare. Public healthcare would benefit everyone, and it keeps the cost lower. The Auditor General talked about P3 contracts, which is public-private partnerships. Those cost $8 billion. They cost $8 billion more than we should have spent on projects that are public-built, publicly infrastructure. So there's ways that we can certainly, tailor financing. But when it talks about healthcare, it needs to be public healthcare because it does serve people better and it saves money. And when people, when their caretakers are in for profit care, private care, it's about profit. So money we spend in healthcare needs to go right to front lines and to patients and to seniors when they need the care.
Okay, thank you. So now moving to, it's related to this idea of building capacity in our healthcare system. You know, you're building the beds, but that means we need people, right? And I'm not talking about people aging, I'm talking about training PSWs, doctors, geriatricians. So I'll just get from each of you an answer on how that's fitting together. So how, as you're talking about building hospitals or building space for more seniors in long-term care, how are you matching that with the training for professionals that's needed? And I'll start with you, Minister.
Okay. Thank you. That's a great question. And I'm going to say there's two parts to this. As we expand the footprint and the beds, obviously we will fund the operating costs. But setting that aside, in this budget, we also said we would invest $300 million more just for staffing in long-term care homes, the existing footprint. So this money is going to go to existing long-term care homes, $300 million. On top of that, we have set an additional $23 million to help retain and attract personal support workers, and I think about $38 million to train personal support workers. In addition, we have also made a commitment to 4 hours of care per resident in long-term care homes. So what I am saying here is I have very concrete numbers into what we are going to be investing to make sure that there's more direct hours of care in our long-term care system.
Okay, Mr. Smith.
Well, to answer your question, it's not working well as far as training PSWs and healthcare workers for those spots that should be available. And I think it's a lack of vision on behalf of the government over the last 15 years to prepare for this. I believe it was Teresa that talked about the gray tsunami or the...
Don't use that word.
I won't use it, but you said it. But,
did I say gray tsunami?
But it's...
I don't
Minister, yeah.
It was the minister? Okay.
Yeah,
Anyway.
don't put words in my mouth.
Right. My point is that there hasn't been a vision for preparing when it comes to training healthcare workers for these long-term care beds.
But
that
so how do you
aren't
do
available.
it? What do you do?
Well, you have to go back and train people for jobs that are going to exist, jobs that are needed, instead of continuing to train people for jobs that don't exist. So clearly, 15 years ago, anybody could have told you that there was going to be this kind of need in the system. However, there hasn't been that type of preparation and training for the workforce.
Okay.
So I'm going to just say that when the NDP government was in government in the 90s, they actually had a standard minimum hours of care. When the Conservatives came in, they reduced that. They actually took that away. So we are now going to restore a standard legislated hours of care. We've been calling for that. There's been private members' bill that's been put in the House for time to care. It's 4 hours of care. And Advantage Age Ontario has said that it's going to take $375 million to accomplish that. So we've dedicated that. The other second piece of that, when we ask, how do we know all these things? If we expand the public inquiry into a phase 2, another terms of reference that we have is level of staffing, right? Best practices in staffing. Those are some of the things we need to examine to get it right. We can't just trust, and I'm going to say trust government at large to say, you know what, we've looked at the capacity and we know that we have evidence-based 5,000. There was no consultations that I heard of. And I don't even know where these 5,000 beds are going to go, right? So we need to have, again, the part where we look at these things, the systemic issues that are happening, to get it right. We don't have a lot of time left, and we should have been planning long ago. But now here we are today. We need to start doing it and do it with consultation with all parties, including family members, people who are going to access these services, people who have been accessing these services are there now, what's going right and what's not working out, finding and fixing the problem, stakeholders, operators. We need to do it in a proper way so we can get it correct. I don't want to come back here in another 4 years and be talking about long-term care and how it's not quite up to par.
Okay, we're going to move on because I'm quickly running out of time. So we're going to move to age-friendly communities. And as you've heard and as you know from your own experiences, that is the goal, to stay in communities. We don't always see examples where people really feel like a place is made for them in community, whether it's urban or rural. So I'll ask each of you to point to an example that you see abroad or in another jurisdiction that you think could work here, and also how you would cooperate with the federal government and the municipalities to ensure those actually roll out. And I'll start with you.
So, in this, municipalities have a really critical role in creating age-friendly communities because they do so much of that infrastructure building within cities. And let me give you an example. Curb cuts. If municipalities have curb cuts on their sidewalks, it's easier for people in a wheelchair. Just a simple intervention. My favorite, I think there's a municipality along Waysaga Beach, I don't know exactly where. Apparently in the summer, they roll out a plastic temporary boardwalk so that people can then use their wheelchairs to access the beachfront. So simple interventions like that at the municipal level, that's what my ministry is funding through our $7 million age-friendly community. Because there's so many little interventions that we can make that just makes somebody very correctly said, when we say age-friendly, it's not just seniors friendly, it's universal design. Simple things like a building code where if you say instead of having those knobs on your doors, which you have to twist and turn, if you have the lever, it becomes easier for all age groups. So you asked for some concrete examples. I shared some concrete examples. I just want to say I'm a big believer in this, and I just want to say I am so happy that I was able to push forward the additional funding for age-friendly communities. I'm very excited.
Okay, Mr. Smith?
Yeah, so I mentioned earlier Wellington on the Lake, which is on the south shore of Prince Edward County in the beautiful little village of Wellington, and it's a great spot, and it's a wonderful community that continues to expand. A lot of seniors are selling their $1 million homes here in the city and moving to Prince Edward County and enjoying their retirement years there. It's a great community because it's self-contained. It offers all kinds of community events and groups and for folks to participate in. But also it is a very accessible community, a gated community that's easy to travel. I had the opportunity to visit a community down in the London area as well that's a net zero community, meaning that they're saving a lot of money on their electricity bills because of the use of renewable energies and their partnership with London Hydro. I mean, there are so many things that can happen. We just have to get the regulations in place. The minister talked about building codes, and there are some things we can do with building codes, and we can make these communities happen right across the province.
Okay, Ms. Armstrong?
So I'm going to say something that I have to toot my own horn. London, Ontario was one of the first cities, and you may know this, to be declared age-friendly by the World Health Organization. So kudos to London for acknowledging that it needs to be age-friendly, now, so that in the future everyone can benefit. And I think when we talk about age-friendly, it really is for everyone. And one of the things the NDP has put in their platform is they're going to implement the Accessibility Ontario's for Disabilities Act fully, so that we can be age-friendly throughout Ontario. Thank you.
Okay, thank you. And I'll just, we're at the
so much more to
2
say.
o'clock mark. So if you do have a question, please start thinking about it, and please approach a microphone. They are scattered throughout the room there, in the center here, where we already have someone there, and there. I'm worried that we are gonna run out of time really quick, and of course, online. And just I'll get one more question in while people are lining up and thinking about what they wanna ask. And this is going on with the age-friendly community and also home care. So, each of you talked about sort of yes, they need to be done, but more simple questions, right? There's lots of questions for people around how they can be safe and secure at home, how they can get the support they need, how they can ensure they're safe. So, for example, you hear about some countries where students will move in with seniors as their dorm, and they co-live and they share house chores. So when we're talking bigger picture, what do you imagine or what do you want to see for seniors or for elderly people who can then still live at home? What supports do they need? Bigger, beyond, not just home care, but think bigger.
Do you want us to respond to that? Okay,
Please.
I thought we were taking audience question. Okay. That's a really good question, and it goes back to that tension between wanting to live independently but being socially connected. A lot of it is really around that. So some of the things that I think we're seeing a sea change in is, for example, community hubs. The idea of co-locating a long-term care home or a retirement home with a daycare. Because for too long we have said, here's the long-term care home, and then 5 kilometers down the street is the child care, and then 7 kilometers down the street is the hospital. Little islands everywhere. While what we really want is for us to be connected. So if you were asking the big picture, so I think the big picture is really reorienting how we lead our lives and how we decide certain demographics are here and certain demographics are here and then certain demographics are here. And so, we really have an opportunity as we build these new long-term care homes. And Teresa, you had a question. You don't know where the 5,000 beds are?
Yeah.
And so just look at our press release. We've given licenses to the first 5,000. It's all there in the public domain, and I'm happy to share that with anybody who wants that. But I think it really is around that whole campuses of care idea, the whole idea that, it's a village. So these sound a little, 50,000 feet level, but I think it really comes down to that intergenerational contact, that seniors, families, so intergenerational families, all of that is, I think, part of the solution to the question that you posed.
Okay, Mr. Smith?
To me, it comes down to affordability, and I think everybody should have the right to be able to choose where they want to spend their retirement years. But unfortunately, because of the unaffordability of Ontario right now, people aren't able to choose. I think what we really need to do as a government is start to prioritize spending and ensure that we're spending the money that we're spending wisely. The budget this year was almost $160 billion in Ontario, and that's another deficit budget. The debt continues to grow, and as the debt continues to grow, that means the interest payments continue to grow, over $1 billion a month in interest payments. You think about how that money could be used to benefit the people of Ontario and our seniors. Seniors want to live a very active life, but so many of them can't because of the unaffordability of living in Ontario. So, giving them back some money, making life more affordable again would go a long way to allowing them to have the choice on what they want to do as individuals.
Okay, Ms. Armstrong?
So in London, again, we have a retirement home that have a model where they have students from Western living with them in a retirement apartment unit, and they are art students, so they contribute to their room and board by interacting and socializing with the seniors and providing entertainment. So there's all kinds of flexible models that we can look to, but we really need to see what seniors want, what their needs are, and work with local communities in order to provide that. When it comes to affordability and staying in your home and staying in the community where you worked and you raised your children, again, we have things in our platform. And one thing that's very interesting that I have to tell you about, it's very exciting, is that we are going to defer property taxes for seniors from municipalities. So the provincial government will continue to pay those taxes, and then once you're ready to sell your home, then that equity will be taken out. There's an evidence-based model in BC that actually works. And so that is an option a senior would have in order to affordability piece, along with our pharmacare and universal pharmacare, our dental care, bringing hydro back into public hands and reducing your rates by 25%. Some of those things are practical things that we need to address to have that quality of care and for you to stay in your home and, age in place, so to speak.
Okay, thank you. So I think this woman here was by far the first in line, I hope. I'm not saying that wrong. So if you could please...
I tried running, but
if you could please give your question and also for who it is, if you want the whole group to respond or if you want one person, go ahead.
So my question is for Mr. Smith. You made a whole list of services for seniors. Access to health care, access to family physician, access to home care. But you also talk about tax cuts. I'd like specifics, by the way. You mentioned tax cuts. I'd like to know how you're going to do that, as well as how you're going to increase access to care while you're also reducing the bureaucracy that actually provides that care. So I would like as much specifics as possible because I haven't heard too many yet. Thank you.
Well, thank you. Yeah. So I think it's clear that bureaucracy in healthcare is top-heavy. Everybody realizes that. Our leader, Doug Ford, has talked about bringing in the lean system and making sure that we're finding savings. But I think the most important thing, I was at an event the other night with a number of doctors in my riding, and all of those doctors were giving me concrete examples of how they could save not just thousands of dollars, but potentially millions of dollars in the healthcare sector. The current government's at war with doctors. They're not talking to doctors right now. And our healthcare workers aren't real happy with them either. So, there are ways that we can save money within the healthcare system. I think everybody realizes that, but what's been happening over the last 15 years is that the bureaucracy just continues to get bigger and bigger, and that...
Dollars. I'm still waiting for the dollars. I haven't heard any dollars.
Well, I don't have specifics for you today, and I said that from the outset. I am the energy critic.
Before Election Day.
I am the energy, absolutely.
All right, thank you.
Thank you.
So we'll go to Jim and Simon if one of you has a question.
Yes, thank you very much. These are coming from the great ether out there, people watching, over 250 people out there. This is a question that comes from Ottawa, from Patrick. A question from our viewers in Ottawa. They're having a viewing party. By 2040, the number of seniors over 90 will quadruple. What will your party do to provide leadership to bring together resources for the public sector, the private sector, the volunteer sector, to address dignified care for the growing population of frail seniors?
Okay, so I'll get each of you to respond to that, and I'll start with Ms. Armstrong.
So we know that people are living longer, and then they enter their, phase of their life where there's more acuity, there's more complex needs. And in order to do that, we need to address, first of all, home care, people who want to stay at home as long as possible. We need to make sure that they can stay there with appropriate care. We do have, again, in our platform, we have committed a cost-effective way to do that, as well as not having hours of cap. So again, conservatives, I believe it was, cap the hours of home care. We don't think that should be the case. It should be based on need, assessment. When we get into a long-term care situation and you have the frail seniors, the BSO teams are really important. Time to care, where we say have 4 hours hands-on care. Again, I would go back to looking at the phase 2 in a public inquiry and making sure and one of them is staffing levels and funding levels in order to meet those needs. So absolutely, I agree with the person who asked the question. We need to make sure our seniors live with respect and dignity and a quality of life. That's what we owe our seniors for building this province and dedicating their lives to us. As I talked about teachers earlier in my opening remarks, these are the seniors that we have to look after. That's our duty.
Okay, Mr. Smith.
Yeah, we can promise all the care in the world, but if we don't have the home care or health care providers, it's going to be impossible to provide that care. So to the question, we have to be training healthcare workers. We have to be encouraging kids in school to get into that field. We're going to need these healthcare workers. As I said earlier, I used to work in this field, and on a wing where we may have had 34 residents, there may have been 6 residents that were a high needs or high acuity or a chronic care patient. If you go onto a long-term care wing now with 34 patients, 34 of them in most cases are high acuity chronic care type patients. So, you know, and they're still running with the same number of healthcare workers as they used to back in the day. You know, I talk to those people. They'll come into my office and they look like they've gone through a war zone, some of them coming off their shift, because it is so demanding on their time. We need to make sure that we're encouraging people to get into healthcare as a career because we need them, as the numbers indicate.
Okay, and Minister?
Thank you. You know, I heard Todd Smith say that, you know, we should have known 15 years ago that Ontario's population is aging and been planning for it. And I want to just say 2 things. 15 years ago, Todd Smith, your Conservative government was busy cutting hospitals and shutting down hospitals.
I was on the radio.
And over the past 15 years, this government has built 21 hospitals, and there's 40 under construction, rebuilding all the hospitals that your government shut down. We've tried the lean system that you keep referring to before. It doesn't work. That's all I'm going to say. Other than, earlier during this discussion, we did talk about the fact that we're going to build 30,000 more long-term care beds, the fact that we're investing $650 million more in home care, the fact that we will be coming out with in our budget, the Healthy Home Credit, which will help seniors over the age of 75 with up to $750 so they can live in their own homes. We have also committed that geriatric training will be now given priority for medical school residency. We're working on a tax credit for respite for caregivers, because we know that when caregivers burn out, it's hard on the person who is living with the complex diseases. So we know that we need to do more. These are just some examples. We're investing $300 million more in the long-term care system so that every home can have a registered nurse. We are investing an additional $23 million so that we have more personal support workers, and an additional $35 million to train existing and new personal support workers. We have a plan. It's working.
Okay, thank you. I'll go to this side of the room because I feel like you guys are getting the short end of the stick today. I'll start with you, sir.
Thank you very much. First of all, I would like to thank both the NDP party and the Liberal Party for having provided answers to the questions that were sent out. As a senior, I like to read, and I will take this home and study it. As a retired teacher, I will study it. I guess I'd like to, first of all, also thank Ms. Marsh when she made a reference to the federal government. And if we had about 6 hours here this afternoon, we could probably talk about the National Housing Strategy, which is federal, provincial, as well as the municipalities. I am a little disturbed, though, when I do hear under the hydro that the Premier, possibly elect, feels he would fire the CEO. I think everyone in this room appreciates the fact that the Premier of any province does not have the right to fire the CEO.
Do you have a question?
Yes. Yes, I'm concerned about the safe injection sites. I'm concerned about the minimum wage, and all of that comes down to the question, how will your party support and promote the mental health of older adults? I think I would like to expand that and say, how would your party support and promote the mental health of all the Ontario citizens?
Thank you. I'll start with you this time,
Okay.
Minister.
Thank you for that great question. And I just want to begin by saying in this budget, we have recognized, as a society, we've done a fantastic job of destigmatizing mental health issues. But what has not kept up, and this is not just one jurisdiction, worldwide, is the supports that are required, because with the destigmatization, there's more work to be done, but the relative destigmatization of mental health issues, more people are coming forward to seek support. That's the good news story. And so in this budget, we announced a record amount. I'm trying to remember, I believe it's $1.3 billion.
2.4.
2.4, thank you. Thank you very much. So double of what I was thinking, $2.4 billion for mental health. But what I really like about that policy is it's a no wrong door policy, because it's really recognized the fact that when somebody has a mental health problem, it shouldn't be that this is the wrong door. If you go to your GP should be able to connect you to the right resources. If it ends up that you're going to your high school counselor or somebody in college, then that person ought to be able to hook you up with the resources that you need. So the whole idea of no wrong door, that's really powerful. It's not just enough to put money in. You need a robust system. So I'm very proud of what the Ministry of Health and the Minister has done in terms of not only are we allocating more money, but we have a robust plan.
Thank you. Mr. Smith?
Well, I would say if you're struggling with mental health issues, you have to be able to find a door. And what I keep hearing is that they can't find the door. There's $1.9 billion that our party has allocated, which was the largest commitment ever by a provincial government for mental health. And that's increased mental health over the next 10 years, matching the federal contribution. But people can't get access to mental health treatment or counseling. I hear it time and time again because the system is fragmented. There are too many different organizations out there and they're not streamlined. That was the job of the local health integration networks, was to streamline that access so that people knew where to go to get the treatment that they need, and it's not happening. We need to streamline that system. And to the gentleman who asked the question, it was the Premier of Ontario, Kathleen Wynne, who said on many occasions that she had the right to remove the board and the CEO at Hydro One.
Okay, that was actually in Hansard, just to fact check
was.
that one. It was in Hansard. I'll go back now to mental health with Ms. Armstrong.
So our party has in our platform, if you're teachers and you like to read over your sunbeam on your on your kitchen table over your coffee in the morning, it's a beautiful day right now, you can check it out. Mental health, we are saying that we actually need a ministry dedicated to mental health so we can coordinate services. Right now there is 11 ministries under healthcare that deal with mental health. And so we need to find mental health a home, and that's by providing it a ministry so that when you do access a social worker, when you go to your doctor, they know where to get that help for mental health. Too many people are falling through the cracks, and we have to fund our hospitals adequately. For the last 4 years, hospitals' budgets have been frozen, which means they have to cut because hospitals have to balance their budgets. We have committed to making sure that we provide funding to hospitals at 5.3%, which is at least inflation. And then also look at the demographics in the area and the regions and the aging population so we can provide the health care for mental health. We have come a long way. There is destigmatization happening, but now we have to push it forward, make sure that we have a home for mental health and addictions, by the way, that's both the ministry would deal with, so that people will have a pathway to health care for those problems and make sure that we don't fall through the gaps. We've seen too many overdoses, deaths. We've seen too many people with mental health go into crisis because of the wait times that have been happening. Wait times for psychiatrists are up 6 months in London. So yeah, that is one of our party platform pieces that we've dedicated into our platform.
Okay, thank you. So now we'll go back to our webcast to Jim and Simon for a question.
We have a comment and a question from both the Ottawa and the Thunder Bay watch parties. So I guess great minds think alike. One of the comments is, Ottawa is an age-friendly city, but ageism is alive and well. The Wrinkle City comment also made me wonder, what is your party's plan to combat ageism?
Okay, so what is your party's plan to combat ageism? I'll start with you, Mr. Smith.
Yeah, to make sure that people have a quality of life that is second to none. They should be able to afford to stay in their homes. There has to be affordable housing. There have to be places for seniors to spend their years and we've talked about it over and over again today. And by the way, that's not me calling it. That's the members of that community who call it that. But this is something that needs to be done, where money needs to be invested to make communities where people can live and feel welcome and have a high quality of life. And when they're struggling to pay their electricity bills and they're struggling to put food on the table, then they simply can't do that.
Okay, Ms. Armstrong?
So I have heard that term before, and I think it...
Which one, sorry?
Ageism.
Okay.
And it's a bad, yeah.
I don't know, Wrinkle City, I don't know.
No, you know what? I'll let them duke it out. Ageism is not a good way to describe people on their journey through life. So what I think we need to do is we need to educate the public. And we also need to promote more intergenerational contact, right? People who have lived, their journey into life and experienced life, lived experience, have so much more to offer back and to give back into communities. So providing those volunteer opportunities where you have intergenerational socialization, you know what, more people who are older should be in media, highlighted and consulted. We need to get out there more as seniors to make ourselves known that it's not about ageism, it's about the experience we can bring to the table. And the other piece I have heard through in my writing about ageism is healthcare. Many times I've heard people try to access healthcare and they feel that because they're older, that they're not getting the extra attention that they deserve. And those things need to, again, discussions and conversations need to change. Because when someone is accessing services, it doesn't matter what age it is, there's no room for discrimination when you need something that's a service.
Okay, thank you, Minister.
Oh, this is a great question. I just want to say that when I first became the Minister of Seniors, I said, this is an issue we need to tackle because of all the isms, this is the one that's somehow still okay. And so, we have something called federal, provincial, territorial meetings where ministers for the seniors from across Canada and the federal minister responsible come together. So the last time we had that, I said I wanted ageism on the agenda, and it didn't happen. People pushed back because all the provinces have to agree. So then after the FPT finished, I once again for this year tried, and lo and behold, we were successful. So I just want you to know that officially tackling ageism will be on the official agenda of all ministers, provincial ministers, and the federal minister responsible for seniors across Canada in the next FPT. I really look forward to that. And just one example of the fact that, yes, we need to raise awareness. Quite simply, it's not okay.
Thank you. I'll go to the woman over there.
Greetings. I am not a retired teacher. This is generally directed to the three of you, although Mr. Smith, you have addressed to some extent this. A lot of the statements that you're making hinge on the work of personal support workers. My nephew just graduated as one, and I watched my mother for 13 years with a long-term, private retirement home supported by the community care access people to keep her in her own home with a 13-year Alzheimer's diagnosis as well as a number of other health issues. She died 3 years ago this week. All of you have talked about the personal support workers' role in taking care of seniors, but I'm curious to know what you guys have in mind to take care of the personal support workers themselves. This has to be one of the most difficult jobs that I have seen people do, with 15 minutes here to help somebody get dressed in the morning, and then they're off to the next client. And I really understand the burnout in this job, and my admiration is deep. So do you have something in mind to support the people that you want to support us?
Thank you. And in the interest of time, I'm going to really push to stick to the 30-second answer for each of you because we are running out of time and I want to get to everybody in the room who's standing still. So Minister, I'll start with you on that question.
So that's a really good question. It's like we all know, it's difficult work, it's hard work. And that's why about 3 years ago, the then Minister of Health brought forward a minimum wage for personal support workers, which was $16 an hour. It was a start. I think that they should be paid way more than that, but at least we put a floor. Because we know if we want good people to do this job, a very difficult job, we need to make sure that they're paid well. That is something that I stand for, whether it's supporting the minimum wage across the province or a much higher floor in the case of personal support workers. We also know we need to provide better training because personal support workers are increasingly being called to look after ever more complex care. I know that they're being called upon to do things that they need to be trained for, and that's why we've set aside $34 million to train existing and, new recruits to personal support workers. It's definitely something that our government has cared about for some time now.
Okay, Mr. Smith?
We simply need more of them. We need more PSWs to assist. I heard on the radio not that long ago that seniors were getting 6 minutes of care in the morning. That's unbelievable. And I think about when I was getting my residents up in the morning and getting them ready for breakfast. There's no possible way you could do it in 6 minutes, but that's what they're getting nowadays. We need more PSWs. That will help with the burnout factor. It will give them some support so they can actually spend some quality time with these individuals who are in the later stages of their life in our long-term care facilities and make sure that they have the dignity in those years as well.
Thank you. Ms. Armstrong?
So we need to attract people into this career field as a career choice, and we need to make sure that it's stable work, full-time work, and worthwhile for people to want to enter this field. And that probably means some benefits in retirement and a decent wage. That's how we're going to sustain the care in our long-term care, in our home care, in our hospitals, as our population's needs change. So by doing that, we need to make it more attractive. And some of those things, realistically, are what I just described. Good wages, benefits, full-time work, and retirement packages, and people will come. And we have to acknowledge most people who provide healthcare in this field are women. So, we have to treat the workforce fairly and equitably.
Okay, thank you. Just for the people still standing, so for the order, I'll come to this gentleman next, and then I'll come to you, and then I'll come to you. So if you want to sit down, you're allowed to sit down, and I won't forget you. I promise you won't lose your place in line. But I leave that up to you if you want to stay standing or not. In the meantime, we'll go to the online team for questions.
Thank you. Just want you to know that there are dozens of people standing online, so lots of interest.
They might be a bit more comfortable than the people standing here.
It's sitting, of course. This one comes from Wilma, and it really is to all three parliamentarians. A number of hospitals, we're told about 40 are under construction. How many of those are or should be in Northern Ontario? The comment here is Northern Ontario is often neglected. The implication is, what are you going to do about that?
Okay, thank you. I'll start with you, Minister.
Yeah, okay, so I just want to clarify here that across Ontario, approximately 40 major hospital projects are under construction. I can get to Wilma a list of how many of those are in Northern Ontario. I don't have that handy with me, but I can assure her that I know personally that, for instance, in Sudbury, we expanded the long-term care home and we built a state-of-the-art hospital. I forget the name in Sudbury. In Thunder Bay, not Sudbury. So I just wanted to, I'm happy to provide more detail at a later point.
Mr. Smith?
Yeah, I'm not sure, but I know there are needs in Northern Ontario when it comes to new hospital builds, but there are needs right across Ontario in urban and rural settings. And in my riding of Prince Edward Hastings, I know that we have a desperate need for a new hospital there. There's been a long fight going on at Trenton Memorial Hospital in Quinte West to keep that hospital open. And fortunately, it is still open and providing 24-hour emergency service to that community as well. So the need is great right across Ontario, and I'm sure it's just as great in Northern Ontario.
Okay, Ms. Armstrong.
So, we have heard that loud and clear. We have several Northern members that always advocate to make sure that there's equitable resources and services through the north and rural communities. And so what we've put in our platform says that, of course, we're going to restore hospital funding to ensure it keeps up with every year with inflation, as I mentioned earlier. But we need to, more than that, look at population growth, aging, and the unique needs of communities in different regions. And that is part of how we're going to accomplish getting healthcare into areas that are underserviced.
Thank you very much. Okay, sir, thank you for waiting. What's your question?
Thank you. The recent years in Ontario have seen a marked increase in the abuse of elders, and very specifically, financial abuse. And at the same time, in the United States, where life insurance settlements are allowed, there's an extensive attack and record of abuse and fraud on seniors. They're directed towards them surrounding this one issue of life settlements. And yet at the same time, during this past year at Queen's Park, a private member's bill was introduced which would allow third parties to access vulnerable seniors' life insurance policies. I'm wondering what your position is with regard to this possible amendment to the Insurance Act.
Thank you. I'll start with you, Minister. So you're in the hot seat.
I am. I just want to begin with something. At Queen's Park, we have a tradition where we can correct our record, so I just want to correct my record. 40 major hospital projects are under construction or various stages of planning. So just wanted to clarify that.
Thank you.
On that issue that you spoke about, it's a very important issue. For those of you who may not be familiar with the idea is that in Ontario, if you have a life insurance policy, you sort of have to pass on before the benefits can accrue. And sometimes if you're a senior and you're in financial difficulty and you have this life insurance policy, but it's going to be only any good after you've passed on while you're struggling financially. So there's there's two schools of thought. One school of thought is why not allow people to cash in that insurance policy rather than wait till they pass on to get the funds. The downside to that is there's a concern that vulnerable seniors could be, lured into selling it for too low a value because, it's of a certain value, but you need money, so you might sell it for a really low value. So in the United States and in Ontario, I know and in Canada, for instance, Quebec allows for that, but now Quebec's looking at pulling back or tightening some of those. So it's not a bad idea, but as with all ideas, it's nuanced, like there's some benefits to it, but then there's the predatory angle to it. So my own position is we need to study this further because to make sure that and if we ever do it, and at this point there's no plan to do it, it's just a private member's bill, it would have to be structured so that the benefits outweigh that risk of predatory people trying to get seniors to sell it at a low cost.
Okay, Mr. Smith.
Yeah, I would just add to that by saying that elder abuse obviously is a very serious issue and shouldn't be tolerated in any form, physical or financial. And we've seen far too many seniors that have been victims of these kind of predatory tactics. Having said that, there is a private member's bill before the legislature. Often what occurs is it gives those in the legislature an opportunity to go to committee hearings and discuss all of the intricacies of a certain piece of legislation so that we can weigh pros and cons, as the minister said, and determine what's in the best interests of seniors. Certainly we don't want to see seniors victimized by predators who are taking advantage of them.
Thank you. Ms. Armstrong.
Yes, so we would work with senior advocacy organizations and community groups to ensure that there are better protections for seniors and so that seniors aren't put at risk for abuse. The other thing we need to make sure is that we have good consumer legislation to protect seniors. And I say that because, again, we're going to have a population growth of seniors, and they are a vulnerable population. And so we need to have better consumer protections. And to your question, I do not agree with selling off an insurance life policy. There are other ways we can help seniors in financial situations. And I'll go back to that platform piece about deferring your taxes as one of the pieces that we could, look at. And universal pharmacare and dental plan, putting money back into the pockets of seniors. So we're not in that situation where we're selling our life or cash our life policies in order to pay for things and being taken advantage of. And I was in the insurance industry before I
Sorry,
became...
we need to wrap up, Spencer. Thank you.
Thank you.
Okay, so we'll go back to the web questions now for Jim and Simon.
So we have had a lot of very interesting questions coming from our participants on the web, and it's very difficult for us to choose which ones to ask. This one is again from our Ottawa Watch Party. So the comment is that the proposals by all three parties today are long overdue steps in the right direction. But with the province sinking deeper into debt, how specifically will your parties pay for these proposals? And a very interesting sub-question here, will it be fair to all generations?
Okay.
Repeat the question, please.
So the question was, given how much debt the province already has, and given that a lot of these promises are expensive, how will you pay for them? And then the follow-up is, how will it be fair to all generations? I think the idea there is future generations paying the debt.
Yeah, I've got an answer for
So
that.
we'll start with you, Ms. Armstrong, and we'll move this way.
Okay, great. So in our platform, we've thought about these things because we've been listening to what people are going through, everyday life. Whether it's affordability, whether it's healthcare. So we've thought about these things. And what we're saying is the most wealthy people need to contribute to our society. The most profitable corporations need to contribute to Ontarian and the quality of life and our economic engine. And right now, we have the lowest, it's not even competitive, it's the lowest corporate tax rate in Canada. So they can afford to pay a little bit more so that we all can benefit. And I think people have, felt that they've been working really hard and they're not seeing a lot of movement in their lives. So therefore, that's how we say that we can pay forward so that we can have these benefits now, and it's not going to affect the future generation.
Is the debt, though, that you accrue going to affect the future generation?
So we would be running a deficit to pay for the services that we all need, all the public
So that
services.
turns into debt, though, right?
That will turn into debt, but eventually it will turn around because we are going to be dealing with having the taxes come back. So there will be a balancing after 5 years. But the thing that we have to remember, when we invest in Ontario, we need to invest in the people that are in Ontario. And so far that has not been happening in a real way. And by doing the taxing piece, people are on board with that. They're saying, yeah, if someone's making $220,000, they can pay 1% more. If someone's making $300,000, they can pay 2% more. If there's a corporation that's profitable, they can add into the benefits that they receive from having people work there.
Okay, thank you, Mr. Smith.
Well, the debt is a serious issue. I alluded to it earlier. This government has actually doubled the debt over the last 15 years. It's approaching $380 billion, and that comes with a consequence to public services. When you're flushing $13 billion a year in interest out the door, then that's going to have serious consequences, and we're seeing that in our healthcare sector.
But on the we haven't seen you square your proposal yet, right? You've proposed to cut corporate taxes. So how do you square that?
Yeah, and there'll be more details coming up in the coming days. I think every day we're releasing another portion of the plan, right? So this is all going to come out eventually. But what we're seeing, though, is a lot of the debt isn't even appearing on the province's books. So when you look at the Liberals' unfair hydro plan, that is basically a borrowing scheme to try and offset the high cost of electricity, the soaring cost of electricity, that debt is being buried over at Ontario Power Generation at a cost of $25 to potentially $93 billion over the next 30 years. That's money that doesn't even appear on the province's books. So that's going to have a massive impact on not just the next generation, but that next generation, unless we fix the soaring cost of electricity.
Okay. Minister.
Okay. I'm going to ask the room a quiz. The Ontario budget has been balanced 8 times. How many times do you think the Liberals have balanced it? Anyone wants to guess? How many times do you think the provincial Tories have balanced the books?
Over what time period are you talking? Any party
I think over the past 40 years. So I've got an answer for you. The Liberals have balanced the budget 5 times out of 8 times. The Conservatives have balanced the books 3 times out of 8 times. The NDP hasn't balanced the books in Ontario. I only put that as background because there are certain stereotypes attached to each party. And then I'm going to explain to you why the Conservatives fail at balancing the books.
Minister, if you could speak to your own,
I will,
to your
I
own
will.
budget, that they want to know.
But
They want
can't-
to know what they want to know why you
I
are
will.
adding more debt on and how and what that means.
Okay, let me just finish my thought. Why the rhetoric doesn't match the reality, because the first thing they do is give massive tax cuts, right?
You've done
How
that
do you
too.
finance those tax cuts? By borrowing. What we are doing when we borrow, we are investing in people. I think we can all agree that if you borrow to invest in an asset, that is something we can all understand. What is the Ontario government's biggest asset? Our people. We are investing in our people. We are investing in affordable tuition so that the next generation has a good chance. So I know they asked about the intergenerational piece. And then finally, our GDP, Ontario's GDP, is $880 trillion. We are going to borrow $6 billion, less than 1% of our annual income, and we are investing it in our people. Thank you.
Okay. The woman with, I believe it's your turn for a question. And again, just a reminder to try and keep your answers short. I know it's difficult. Please go ahead.
My question is directed at Mr. Smith. Mr. Smith, through your comments in the introduction and also your responses to the questions, and the fact that your party did not provide us with the answers to the pre-event questionnaire, you strike me as a man in search of a policy. I would like to know, when is your party going to publish a platform that will detail what you intend to do in this province if elected, and will you have costed out your policies?
So yes, there is a plan, and the plan is being rolled out at the pace that we are going to roll it out. We'd say it's our plan. We're going to roll it out. I mean, I remember last summer, everybody was demanding our plan. We had to have the PC plan last summer. The plan was out. Now the plan has changed. There's been a lot that's occurred over the last 3 months, clearly, and anybody who's been paying attention knows that. We are scrapping the cap and trade system. We're not going to have a carbon tax. That's going to save everybody money on everything that you purchase. Everything that you purchase is going to come down in price as a result of that, because that's what happens. A carbon tax puts additional cost on everything.
Okay.
Now, as a result of losing that cap and trade money, there's changes that have to be made to the platform, and that's why we're rolling it out piece by piece over the coming days, and a fulsome plan will be coming. Have patience.
All right, thank you. We'll go back to the web desk now, Simon and Jim.
Thank you very much. This is from Doreen. She writes, we've spent over $1 billion developing e-health of sorts. When can we expect to have a system in place like they have in Alberta, where they just enter your health card number and all your test results, x-rays, prescriptions, et cetera, arrive on the screen?
Okay, I'll leave that just for you, Minister. I know that's a health department, but I'm wondering if you can shed any light on that.
Yeah. So, I like to say that the media always covers the planes that don't land, but doesn't usually cover the planes that land every day. And it's the same with government, any government, not just our government. And so I know that, when it comes to e-health, there's been a lot of reports around what didn't work for it. But along the way, behind the scenes, quietly, work has been progressing, has progressed. I'm not going to defend the indefensible, which is, when mistakes were made, they were made. But I do want you to know that my understanding is, and I can go back and clarify that at this point, almost every Ontarian is now covered with e-health. The challenge is that we need to get the systems to speak to each other, and that's what we're working on, the integration, so that we can have a system. I wasn't familiar with the Alberta system, but it sounds great. I can tell you, when I go to the lab system now, as most of you probably know, you can get those test results online, and I know that that's fantastic. I love it. And I'd love to see that happening in e-health. I just want to assure you, I don't have the perfect answer for you, but progress is being made.
Okay, thank you. We'll go to this side of the room.
I'm a retired teacher, and I'm proud of the fact that I did that all those years and took my reward money, like you all have, and just run and jump and have a wonderful time with our rewards. Now, I object to the S word, and Teresa, I really appreciate you bringing that up. I've objected to that for a long time. It's compartmentalizing us and putting us into this convenient slot as people on the way out. And that's disrespectful. Being an older person, I am an older person, I'm an adult, and I've earned that designation, as we all have. Now, I do have a question, though. Alienation. The S word brings alienation.
Can you say what the yes word is?
Oh, senior.
Okay.
And that's what we call it in my house. It's an S word, that's what it
S-word,
is.
okay.
And so I wondered, alienation is far too prevalent in our society, and I went to university in this city and came back after all those years, and I live here now and I love it, but when I do the streets, I'm doing my thing around here, there are so many people who live on the street and who sleep on the street, and of many ages, and there's far too many older people who are doing that thing, and they are alienated, and they're alone, and there are tiny pilot projects that I've heard about through churches who are trying to reach them and try to bring them in to tell them what those resources are. You can say, well, okay, you can go to this door and that door, you can call this doctor or go to your doctor. There are people who just don't have the sense of self anymore to do that, and they huddle in rooms that they rent, or they sleep in corners on the street. How do you reach them with your plans?
Okay, so just so everybody knows, we have reached the end of questioning, so I'll get each of you to, I'm sorry, sir, I don't know, do you want to add your question in now and they can answer both?
It's just a question that was put up.
Do you want to add your question in and they can answer both at the same time?
I applaud this lady for her comments. Of course, I still play old-timers hockey. I'm sorry to call me senior if you want, but I'll address this gentleman's issue in regards to the minimum wage. I think it should be $20 an hour.
Okay,
And,
what's your question
my
for
question being is, I know it's a federal question, but I'm a retired nuclear worker. Justin Trudeau campaigned under his campaign promises was to strengthen the middle class. So I'd like to know how you can strengthen the middle class, because there's 4,000 nuclear workers about to lose their defined benefit pension plans. So I'd like to know how you would consider that strengthening the middle class. So which one, there's no federal politicians up there, but what would the individuals up there, the MPs, do to strengthen the defined benefit pension plan? And of course, it's disillusioned. The other question is, how much does Morneau Chapelle play?
That's definitely a federal question, so I'm going to stop you right there. But thank you very much, sir. So we'll ask you to address strengthening the middle class, defined benefit pensions, and poverty. That was your main question, right? Okay. No pressure.
In 30 seconds. I've been complaining about the 30 seconds from the time we started. Sorry.
We haven't been sticking to the 30 seconds.
So the pension
anyways.
question, the NDP government is fully committed to improving Ontario's pension landscape. First and foremost, and then we will expand the pension coverage to more Ontarians to try to undo the growing unsettling trend. More and more Ontarians are left behind to fend for themselves. And what we're going to do is, right now the pension benefits guarantee fund was $1,000 for years, and it's been changed to $1,500. We believe it should be up to $3,000. We need to change that to $3,000, so that way people actually can have the cost of living happen. So that's one of our commitments that I had answered in the questionnaire. So the other questions?
The poverty reduction.
Poverty reduction. So we do need to do much better. She talked about isolation as well, I think I heard. I think we need to start making society understand that we need to care for each other. So when you see someone, in need or perhaps is isolated, they're reaching out to find out how to approach them, because it is their space, right? And we're not professionals necessarily, and we don't know what their medical issues are, or any kind of other parts of their health care. So maybe accessing a service that could help them, notifying someone perhaps. Maybe just saying hello is all that you need to do, developing. So we need to start caring for each other. If that is literally what you're saying is people who are isolated, how do you reach them? Slowly trying to develop a congenial, neighborly relationship
But so I'm doing this from a humanitarian piece, how I kind of would approach it if I would have seen someone in my neighborhood that way. So I would slowly try to, get to know them a little bit in a safe environment that I think they might have. And then from there, if you develop that relationship, then start talking about, I've gotten help here, and, this is what happened to me. But on a perspective, if it's a mental health issue or an addictions issue, we are talking about, as the NDP, we want to create more supportive housing so that if people do get treatment, they're not left alone and they're not back in crisis in their old, situation. So supportive housing is something that we say we need more of so that people who have mental health and addictions have those supports and can live in homes. And we also have a plan for building more affordable housing, social housing, cooperatives, and inclusionary zoning in rentals as well, so that we increase that percentage. And we also have dedicated in our platform to hiring more social workers so we can provide that supportive housing. So on that level, if you're talking about just how do you acknowledge when there's someone that needs help, and then on a social level, what does government do? We are talking about building more supportive housing so that people with healthcare issues have those supports and they can stay at home and not end up on the street, not end up in emergency rooms, places that they shouldn't be, and even incarceration, which is horrible.
Thank you. Mr. Smith?
Yes, so thank you to everybody for the questions this afternoon, and it's been great to be here for the last 2 hours speaking with you, and pinch hitting for my colleagues today. I would say that the S word, I had not referred to the S word before. I would say probably the C word is what we need to look at, and that would be community. And I'm making Teresa blush.
What is the C word?
But community is responsible for ensuring that we look after vulnerable seniors in our community. And the way we can do that, we have thousands and thousands of surplus properties across the province that should be used for community hubs. And I know there is a movement to create these community hubs, but it's at these community hubs where people can get the supports that they need and feel like they're a part of the community. And by relinquishing our hold at what used to be the Ontario Realty Corporation, now Infrastructure Ontario, on some of these buildings and allowing community groups to develop and build out on these programs, we can ensure that people have the supports that they need.
Okay, Minister.
Well, I think we should rename seniors to people who have lived successfully longer, but that's just my... But jokes aside, I just wanted to say there's no easy answers to the question that you raised, which is trying to help the most vulnerable, because the most vulnerable are the least likely to know what supports are available. There's no easy answer, we just have to do better. On the pension issue, I just wanted to say two things. The budget did increase the PGBF. Ontario is, I believe, the only province in Canada that has a PGBF, which essentially means if your private sector pension goes bust, the PGBF will pay you up to $1,500. It used to be $1,000, and Ontario is the only province that has that. And the second piece that's really close to my heart is when I saw what was happening with Sears and the asset stripping, and then I'm a chartered accountant, for those of you who don't know. One of the things that really intrigued me is that across the world, not just Ontario, corporations can increase their dividends while at the same time falling behind on their pension solvency obligations. It makes no sense. It makes absolutely no sense that the laws allow a company to say, come to any government and say, hey, we need some leniency with our pension obligations, but at the same time are increasing their dividends. So in this budget, there was one line that not everybody may have read in that big tome, which commits. It's similar to the UK model. I, as the Minister of Seniors, advocated very strongly for that, which is to say that the regulator will now be able to will have the ability to scrutinize any company that is at once saying, hey, I can't meet my pension solvency obligations. What's going on the dividend side. I'd like to even see that the CEO doesn't get an increase, but that's out of my hands. But anyway, just to say it's a very small step. Personally, if you ask me, it doesn't go far enough, but it's a start. So it's definitely on a horizon.
Okay, thank you very much. We technically have surpassed our time, so if it's okay with everybody, we're going to skip the closing remarks. I think you all have a pretty good idea of where people stand. So thank you again to Minister Demerla, Ms. Armstrong, and Mr. Smith, and I'll pass it now back to Martha and Simon.
And thank you very much, Marika, for a very animated conversation. They're a tough crowd to keep in line here, but you did a fine job. Thanks to our guests, Honourable Minister Deepika Demerla and MPPs Teresa Armstrong and Todd Smith. Thank you so much for taking time out of your busy schedules. And dare I say, thank you for sharing issues on seniors and other things with us today. I'd also like to thank our audiences in Ottawa, in Thunder Bay, and here in Toronto. So thank you all for being with us, and the rest of Ontario. There could be others who have drifted in as well. As I mentioned at the beginning of today's town hall event, this is the beginning. And the next steps are up to you. You are the vibrant voices, so it's where we go next is up to what you say and what you do. So hopefully when a candidate comes to your door, and they will if you live in a city. I live in the country. Nobody comes to my door. But if you live in a city and they come to your door, you've got questions for them. And if you and when you attend an all candidates meeting, you have questions for them there too. So please ask those questions because we want to hear the answers. And we want those answers to become reality. And that's what we're looking for. So we're making it easy. Visit the website, vibrantvoices.ca, to get the information and the tools that you can all use to make seniors' health care, action against elder abuse, retirement income security, and age-friendly communities priorities during this election. Simon.
Thank you, Martha. Donc, lorsque vous visitez le site web de Voix Vibrante, vibrantvoices.ca, assurez-vous de vous inscrire pour recevoir nos courriels, car Voix Vibrante vous enverra des mises à jour régulières sur les enjeux concernant les aînés. Utilisez les outils à votre disposition pour avoir de vraies conversations avec les candidats, les voisins, les amis et la famille sur les enjeux dont nous avons discuté aujourd'hui. As educators and federal public sector employees, so federal public servants, members of the Canadian Armed Forces and the RCMP, RTO, ERO, and federal retirees members devoted their careers to making Ontario and Canada the province and country that they are today. In retirement, our members continue to contribute to the well-being of their families and their communities. Le but de notre participation à Voix Vibrante lors de cette campagne électorale est de continuer à contribuer au succès et au dynamisme de nos collectivités et de notre province. Ensemble, l'organisme Les enseignantes et enseignants retraités de l'Ontario et l'Association nationale des retraités fédéraux s'assurent que les enjeux de politique publique les plus importants pour nos membres, pour les personnes âgées et pour leurs familles sont à l'avant-plan, non seulement dans le cadre de la campagne électorale, mais aussi en tenant le prochain gouvernement de l'Ontario, quelle qu'en soit l'allégeance politique, responsable de faire mieux pour les personnes âgées. So with that, and again, with many thanks to Minister Demerla, MPP Smith and Armstrong, and Marika for today's conversation, we'll close. Nous tenons à vous remercier de vous être joints à nous ici à Toronto et à travers la province. Thank you for joining us here in Toronto and across the province.